Hello and welcome. My name is Cindy Scott and I'm a WashU graduate. I earned my bachelor's degree in psychology in 1982, and through the 3-2 program of social work, I earned my master's of social work in 1983. I'm a professional fundraiser and I currently serve as the Vice President of Development for Parkland Foundation, which is the fundraising arm of Parkland Health and Hospital System, where President Kennedy was treated in 1963. I've served on WashU's Dallas Elliott Society Committee for the last few years. On behalf of the Washington University Alumni Association, I'm excited to welcome you to our program today. Dr. Ronald C. Jones is a surgeon and the only remaining living physician who operated on both President Kennedy and Lee Harvey Oswald. I've come to know Dr. Jones over the last 10 years as he was honored as one of Parkland's Giants of General Surgery several years ago. He has been extremely generous with his time in assisting me in fundraising for the John F. Kennedy Park for Hope and Healing and Heroes. We intend to break ground on that park at Parkland later this year to honor the many healthcare heroes and other heroes in our community who have been an inspiring part of the pandemic. In just a few moments, I will be honored to share Dr. Jones' background and accomplishments with you. Before we begin, I'd like to explain the format for today's webinar. You will only hear and see me and Dr. Jones. Dr. Jones' presentation will last about 45 minutes. We encourage you to ask questions by typing them in the chat box. When the presentation concludes, I will have Dr. Jones answer 10 of the previously submitted questions, and then we will answer as many of today's questions as time allows. I will ask the last question of Dr. Jones at 5:25 p.m. This webinar is being recorded and will be posted on the Washington University Alumni Association's YouTube channel following the event. Dr. Jones was born in Harrison, Arkansas on August 24, 1932, and spent most of his early years there. He was born an only child on a farm that he worked with his parents. Their home had no plumbing for many years. It was a humble beginning for this amazing man. Dr. Jones still owns and actively oversees his family's farm. He attended the University of Arkansas and then entered the University of Arkansas School of Medicine, eventually transferring to the University of Tennessee School of Medicine. He completed a rotating internship at the Los Angeles County General Hospital, and in 1958, he began a general practice residency at the University of Oklahoma Medical Center in Oklahoma City. During that training, he became interested in surgery and did his general surgery residency at Parkland Hospital from 1960 to 1964. After his residency at Parkland, Dr. Jones remained on the surgical faculty of the University of Texas Southwestern Medical School, where Parkland is the lead teaching hospital. He rapidly rose to the rank of full professor within 10 years. In 1976, he was acting chairman of the Department of Surgery at UT Southwestern and an actively involved medical leader at Parkland. In 1987, he moved to Baylor University Medical Center in Dallas as chairman of the Department of Surgery, where he served for 25 years. Dr. Jones continues to serve Baylor as a chairman emeritus of surgery, and he still attends committee meetings and conferences. Dr. Jones has contributed continuously since 1964 to medical knowledge. He has published more than 160 peer-reviewed articles and book chapters. His interests have focused on trauma, surgical infections, and oncology. He has moved medical care forward in the United States through his work. He was the major player in establishing modern citywide ambulance service in Dallas, and his work with the American College of Surgeons established standards for cancer therapy throughout the United States. Dr. Jones has received a number of awards, including one from the Mayor of Dallas for his work involving emergency medical services, from the American College of Surgeons and the American Cancer Society for setting standards for cancer therapy, and from the University of Tennessee College of Medicine as Outstanding Alumnus in 1996. Despite these accolades, Dr. Jones remains a humble servant leader who puts his patients and his colleagues first. I'm delighted to present to you one of our country's preeminent healthcare heroes, Dr. Ronald Jones.
President Kennedy has been shot by a would-be assassin in Dallas, Texas.
Going to Parkland, code 3.
This is a shot of the emergency room where President Kennedy died on Friday.
Tonight, exclusive. The doctors who tried to save JFK relived that awful day inside Trauma 1 at Parkland Memorial Hospital in Dallas. They're vivid memories of the president on the operating table. Dr. Ronald Jones, one of the first doctors to see the president at Parkland Hospital. He worked on Kennedy in the trauma room, was then chief resident of surgery. He was 31 years old at the time. 2 days later, he treated Lee Harvey Oswald. He's now chief of surgery at Baylor University Medical Center in Dallas. What were you doing at the moment you heard?
Dr. Malcolm Perry and I had just completed a major vascular procedure and went down to the cafeteria to have lunch. And just as we sat down with our trays, the page operator began to page Dr. Tom Shire's stat. Dr. Tom Shire's stat, he was chief of surgery. I knew he was out of town. I knew he didn't have any patients in the hospital. And then she began to page other chairman's stat. I'd never heard that before. And so I got up and went to the telephone on the wall in the cafeteria, and I called the operator and I said, why are you paging everyone's stat? And she said, Dr. Jones, the president's been shot and they're bringing him to the emergency room and they need physicians. And that will give you a tremendous adrenaline rush. I turned around and right behind me happened to be Dr. Pepper Jenkins, chief of anesthesia, and Audrey Bell, who was the director of the operating rooms. And I walked over and I said, you're not going to believe this. The president's been shot and they're bringing him here. And Dr. Jenkins said, well, I'll get an anesthesia machine to the emergency room. And Ms. Bell said, well, I'll get an OR ready. And I think we thought at that time that he'd probably been shot in the chest or in the abdomen. We would take him to surgery and treat him and he would recover. I then walked over to Dr. Perry, whom I was having lunch with, and told him what was going on. By then, people were beginning to stand up in the cafeteria as the page operator continued. We didn't have beepers or cell phones then, so we got our messages by overhead page primarily. And about that time, Dr. Red Duke came up, and he was a fourth-year resident. I told him what had happened, and we quickly ran out the back of the cafeteria, down a hall, down a flight of steps into the front of the emergency room, went to the back of the emergency room where trauma room 1 and trauma room 2 were. The door to trauma room 2 was closed, and Dr. Perry and I went into trauma room 1. Mrs. Kennedy was standing to the left of the door as we entered with her pink bloodstained suit. She had an expression of anxious. I got the impression that she had thought this could happen. It had happened, but she was not emotional in any way. This was the way that the trauma room was set up 57 years ago. We had the cabinet with chest tube drainage apparatuses and venesection trays, endotracheal tubes here. We had a respirator, and the president was on this type stretcher. As I looked at him, I noticed that his face seemed relaxed. It just didn't seem normal, but we'll get to that in a moment. I noticed a small, what I described as a 1/4 inch wound in the midline of the lower neck, just about where the tie knot was. And I knew that he had a large wound in the back of the head. There was blood on the cart, but we didn't stop to examine the head. Dr. Jim Carrico, who was a second-year resident, was in charge of the emergency room, and he was attempting to put an endotracheal tube into the trachea or the windpipe because he thought he had seen the president make some attempt at breathing when he came into the emergency room. And he also said he thought he might have heard a heartbeat. That triggered the resuscitation effort. The president's arms were out on arm boards, and I was on the left side of the president beneath the left arm board, and Dr. Perry and I quickly decided that he would do a tracheotomy and I would do a venesection or an incision to isolate a vein to get the IV going. And I couldn't get to these trays at the time because the room had literally filled within a matter of seconds. This is an 11 by 16 foot room. So a nurse handed me a tray over the heads of those physicians and nurses, and I couldn't get to sterile gloves either. So barehandedly, I did the venesection. Now this is what we saw. This is an autopsy picture, but the this little divot right here in the bottom of this incision was what we thought was an entrance wound. I think everybody thought it was an entrance wound. This is the tracheotomy incision that Dr. Perry made. You'll notice at the level of the scalp here that he had a little part in his hair, which was normal. His eyes were open, and I never saw really any evidence of life. But the nurse and I cut his jacket, his coat, and his shirt up to the level of the shoulder, and I happened to see a vein. It's called the cephalic vein in the upper arm. Barehandedly, I made a quick incision over it and isolated the vein, put a polyethylene catheter in the vein, and we hung a bottle of Ringer's lactate or salt solution. By that time, Dr. Charles Baxter had come in to help Dr. Perry with the tracheotomy, and he was on the right side of the president above the arm board. He was followed by Dr. Robert McClellan, an assistant professor, and Dr. Perry asked Dr. McClellan to hold a small retractor in the neck. And as Dr. Perry and Baxter were performing the tracheotomy, they heard a gush of air. And it wasn't clear whether that was coming from the windpipe or was it coming from the left or right chest. So I asked Dr. Perry if he wanted me to put a chest tube in, and he said yes. And this is a picture of what we had as a chest tray at that time. These are large trocars. They're sharp on the end, and I put it in the upper mid portion of the chest. You pull the handle out, and these rubber tubes we would cut holes in and thread them through that cannula to get into the chest in case the lung was collapsed. We connected that to a closed chest drainage bottle and asked Dr. Carrico if there was anything there. He said no. And so then it became questions whether we should put one on the opposite side. By then, Dr. Paul Peters, chief of urology, was over there along with Dr. Baxter. And so the three of us, I standing still on the left side, put a chest tube in on the right side. By that time, we had asked for a portable EKG machine to be brought in. We didn't have monitoring equipment as we do now in the emergency rooms. And so we hooked the EKG machine, the electrocardiogram up, and as far as I could tell, it just showed a straight line. There was no evidence of heart activity whatsoever. It was about that time that Mrs. Kennedy passed word to us that she did not want the president pronounced until a priest had arrived. And we weren't sure what to do at that point. By then, Dr. Kemp Clark, chief of neurosurgery, had arrived, and he was looking at the tremendous injury to the head wound, as well as Dr. Jenkins, who was now had the anesthesia machine hooked up to the endotracheal tube that Dr. Carrico had inserted. And we decided we questioned whether or not we should open the chest. And Dr. Clark gave us a hand wave to not do that, implying that this was a lethal injury. And so Dr. Perry began to do some closed chest massage. That was fairly new in the early 60s. And I pulled the president's trousers down to see if I could feel a pulse in the groin with the closed chest massage. And in doing so, I found the president had an ace bandage wrapped around his abdomen that was holding a back brace in place, and the elastic bandage went down the right side, right leg. It was at about that point that I decided I had done all I could do, and I wanted to call my wife, who was a dietitian at the VA hospital, and tell her what was going on, not realizing that this had been on national television and everybody in the world knew that he had been shot in a parade. I walked out the door and a man immediately came up with a large badge in his hand, and he said, "I'm with the FBI and I need to call J. Edgar Hoover." And right behind him was a gentleman from the Secret Service with another badge, literally filled the palm of the hand. And he said, "I need to call Joseph Kennedy and tell him the condition of his son." And that was when it really hit that what had just happened. We had treated him as we would any other trauma patient, getting an airway and an IV going. And I didn't know what to do at that point. I thought, what if he did come around and after I'd left the room? I didn't think so. I thought he had died. And yet I didn't want to be the one to say that. And then there was the issue with Mrs. Kennedy saying she did not want him pronounced until a priest arrived, and a priest had not arrived. So they said, "Can you take us to a telephone?" Well, I took them to the front of the office in the emergency room. All the lines were tied up. People were calling in from probably all over the world. I took them up one flight of stairs to the switchboard, and that was the type where you had a plug in and plug out. And they couldn't get a line out there either, but I left them there. And I thought, I know where I can get a phone. I'll go up to the 4th floor with a payphone and I can call out with a dime. And so that I did. And it triggered an idea that we needed a system in the hospital where we could call out, but nobody could call in. We could call radiology or the operating room or the blood bank. It had been well publicized 3 days before November the 22nd, the route of the parade. And the route was to come from Love Field and then down Main Street. And it was estimated that about 250,000 people viewed that. You can see there 15 deep along the street on Main Street. He would take a right onto Houston and go about a block and then take a left on Elm and get down near where the grassy knoll is. At the point that people behind him were following, there was Bob Jackson and Howard Brennan. And both of them saw someone in the 6th floor depository bookstore here in the window on the 6th floor. And they noticed that it was a man, young white man, probably weighed maybe 165 pounds. They estimated 35 years old. And initially that this was probably thought this was some type of security. It was then heard that the shots were fired, and it was later determined that he was hit at about 265 feet from the 6th floor window. We had not seen the Zapruder film, and so as soon as he was struck, this is a slow motion blow up. It's a little fuzzy, but as the president comes around the corner in the open top limo, you'll see him go behind a street sign. And then as he comes out from behind the street sign, his arms go up in a reflex motion that indicates his first hit. Connolly's falling back right there. There's the second hit. And Clinton Hill is crawling on the back of the limo. William Greer is speeding off to Parkland Hospital. People didn't know from where the shots came. This is a group on the grassy knoll, but the police thought that as they look up that they were coming from the school book depository. And so they entered the front and went up to the 2nd floor, and there was someone getting a Coke out of the Coke machine. This is only about 2 minutes after the shots were fired from the 6th floor. Turned out it was Oswald. And Patrolman Baker called for him to come over. He wanted to talk to him. But the supervisor, Mr. Truly, said he works here, it's okay. And so that they did not talk to him, and they went on. Oswald goes down to the first floor and out the front door with his coke within about 3 minutes. He goes east for about 6 or 7 blocks and gets on a city street bus. On that bus was a Mrs. Bledsoe, from whom he had rented a room a week or 2 before. She recognized him, but she didn't know the president had been shot at that time. And with all the traffic and the number of people that you saw, the bus just couldn't move very fast. So after a couple of blocks, he got off and went south about 4 blocks to a Greyhound bus station, or Greyhound bus stop, and caught a cab. And this is now at about 12:45. It took the cab several minutes to get to his house, or his rooming house, where he was staying at 1028 Beckley Avenue. And he ran in and grabbed a jacket and perhaps a pistol. The lady taking care of the house asked him where he was going in such a hurry, and he did not make any comment. He leaves this house at about 1 o'clock, and he goes down Patton Avenue. He gets at about 9/10 of a mile from there. And in the meantime, Mr. Truly at the school book depository has said for everyone to come to the lunchroom. Everybody showed up but Oswald. So they put out a bulletin with his description, and he's now in Oak Cliff, quite a distance from the school book depository. But J.D. Tippett, the patrolman, sees him and thinks, well, he matches the description of the individual they're looking for. So he calls Oswald over to the police car. Oswald comes, and Mr. Tippett gets out and comes around to the front of the vehicle. And when he does, Oswald pulls a pistol and shoots him 4 times, apparently once in the head, and kills him immediately on the spot. Helen Markham saw it. She was standing not far away, and she saw him shoot J.D. Tippett. This is his picture. He was 39 years old, had 3 children, and you may have noticed day before yesterday on March the 2nd, 2021, Marie Tippett, his wife, died at the age of 62, at the age of 92. He emptied his pistol and threw some cartridges into bushes. They found 4 of them later and determined that those cartridges matched the pistol that he had. He bought this pistol and had it shipped to him in March, and it was shipped to a post office box in Dallas to A.J. Heidel. When he was arrested, he had some false cards from Selective Service with the name of Heidel, and it was thought that because of his loyalty and admiration for Fidel Castro, that he had substituted the F in Fidel with an H for Heidel. This was purchased from a store in Seaport Traders in Los Angeles, California for $29.95. Number 7 in this picture is where Oswald's house was. Number 5 is where he shoots Mr. Tippett, J.D. Tippett, at 10th Avenue and Patton. And number 6 is Jack Ruby's apartment at 223 East Ewing. It's interesting that he was, big as Dallas is, that he was that close to Jack Ruby's apartment. He obviously was not going to the theater, which is where he ended up, which is at number 4. After he shoots Mr. Tippett, he goes to toward the theater, and just before he gets there, there's a shoe store. By then, the police have been notified that a patrolman has been shot, and so they're running up and down the street with sirens going, and he runs in the shoe store, turns his back to the front window, as the police pass, and then he runs out and runs into the theater without purchasing a ticket. The manager of the shoe store noticed that he seemed very nervous, and with all the police around, he thought maybe something that had to do with this individual. So he goes to the cashier and said, a fellow just ran in without purchasing a ticket. They decided to call the police. The police came and they said, well, let us get positioned in the back of the theater and in the front and behind the screen before you turn the lights on. They did. They turned the lights on. There were very few people now at somewhere in the range of 1:30 or 45 in the afternoon. And about 2/3 of the way back, someone got up and walked back about 3 seats and sat back down, 3 rows. And it was Oswald. And so they immediately went toward him, and Patrolman Patrolman McDonald told him to stand up, which he did, and he pulled a pistol. McDonald somehow was able to grab the pistol, and maybe with between the thumb and the index finger prevented the hammer from firing, and Oswald had attempted to shoot him. Now, there was a scuffle that went on, and Oswald obviously was hit. He was in a police car by 10 minutes till 2, and he was in the city jail by 2 p.m., which was about an hour and a half after the president had been shot. When the news media asked him what happened to him, he said, well, the police did this, and he denied that he had any knowledge of what was going on. In the meantime, at about 2:30, Judge Sarah Hughes swears in Lyndon Johnson as the 36th president of the United States. Here's Lady Bird, and behind the hand here is the chief of police, Jesse Curry, and Mrs. Kennedy at the side. They wanted to get LBJ out of Dallas as quickly as possible because they didn't know what all was going on. He didn't want to leave until Miss Kennedy was ready to leave on Air Force One, and she wouldn't leave until the president's casket was on board. He had been taken from Parkland to a funeral home and placed in a casket and then loaded onto Air Force One. By about that time, or perhaps a little before, the police had gone to the 6th floor, and they noticed all these boxes in front of a window that faced Elm Avenue. And so they went behind, and lo and behold, the window was up, boxes were stacked, so that if someone had a rifle and put their elbow on those boxes, they could rest their elbow and have a pretty good shot, particularly with a scope on a rifle at someone on that street. Nearby, right in the floor beneath the window, these 3 circles are around 3 shells, rifle shells, and those were subsequently proven to come from Oswald's rifle. The rifle was found among the boxes, and that morning he had ridden to work with a Mr. Frazier, and Frazier asked him what he had in a brown wrapped bag with tape around it. And he said, these are curtain rods. Frazier knew that he took that bag into the school book depository. And so it was assumed that he unwrapped it and reassembled the rifle. In fact, the paper was found, parts of it near the rifle, and it had Oswald's palm print on it. This is Lieutenant Carl Day, who was in charge of fingerprinting the rifle. He died at the age of 94 in 2008. And this is Mannlicher Carcano Italian rifle from World War II. And Oswald had purchased it from Chicago with a coupon from the American Rifle Association, and he paid $12.78 for it. He bought the scope, 4-power scope, for $5.47 and $1.50 postage. So for $21.50, he had this shipped to the same post office box that he had open from October of 62 until May of 1963. There were no fingerprints on the outside of the rifle, but if you took the stock off, the barrel that was underneath the stock did have his fingerprints on it. And if you went to the butt of the gun, there were some fibers that were from a blanket that he had it wrapped in at Marina's place. He and Marina Oswald were not living together at the time. He was living in Dallas and she was living with Mrs. Johnston in Irving. It was said that she cried when she saw on TV the president had been shot. She knew that he had tried to kill General Walker in April of 63, and she knew where he kept his rifle in the garage. She went out and the blanket was there. She didn't open it and assumed the rifle was still there. The police came to her place about 3 o'clock that afternoon and said, "Does he have a rifle?" She said, "Yes." "Can we see it?" She goes and they unwrap the blanket and the rifle is not there. When Will Fritz, director of homicide, began to interrogate Oswald that afternoon, they showed him this picture and he said, "Well, this pistol and this rifle have been superimposed on this picture." This was a picture that Marina apparently had taken that spring. By 6:30 that night, Mrs. Kennedy is deplaning. You can see her bloodstained pink suit. Robert Kennedy, and this looks like to me in the middle of these men that's J. Edgar Hoover. They flew to Andrews Air Force Base. When they took off from Dallas, they weren't sure where they were going, and they knew they were going to Andrews Air Force Base, but where were they going to take him? Walter Reed or the Navy Hospital? She said, "He's a Navy man, take him to the National Naval Hospital for autopsy." That afternoon, I brought an evening edition of the Dallas Times-Herald. And this was what it said. Connally was hit. And you can see, I call it again attention to this hairline right here. And you can see the little divot in the part. Interesting, you may not be able to see this, but the Dallas Times-Herald at that time newspaper sold for 5 cents. Oswald was interrogated 8 different times between the afternoon and 11 o'clock that night. And so the news people were allowed to be in the hall. So with those 8 trips back and forth, he passed them 16 times. He continued to deny any knowledge about the assassination. The city jail now has been converted into a law school, a relatively new law school, but they have kept the cell that he was in and the little room that he was interrogated intact, still there. He was charged with the murder of J.D. Tippit at 11:30 that night, and about midnight, Jesse Curry, the chief of police, Jesse Curry is seen here, was allowed him to be brought before the news media. And in that crowd was this gentleman here, Jack Rubenstein. The police didn't think much about it. He frequented the police station and he owned bars, Carousel Bar and Strip Club, and they would stop by there to see how things were going. He would serve them coffee, and so they knew who he was and didn't think anything about his being there that night. The next morning, they asked everybody to write down what they had done the day before, and so I just wrote this out and scribbled it in longhand and just mentioned that I'd gotten the call. Dr. Perry and I went down. He did the tracheotomy and I put in chest tubes and did the cut down the venous section to get IV started. And then the patient seemed to have expired. Closed chest massage was done, and then he was pronounced. I didn't see this for a number of years. And when I did see it, it was labeled top secret. In the next morning, this is on Saturday morning, Commander Hume, who had performed the autopsy, called Dr. Perry. And he said, "We can't put this together. The president's been shot in the back and he's been shot in the head, and we don't find an exit wound and we don't find a bullet." And Dr. Perry said, "Well, I made the incision for the tracheotomy through the wound in the neck." And I show this because this is where he had in the coat, this is 5 3/4 inches from the collar and about 1 7/8 inches to the right of the midline where he's shot in the back. And then the fibers from the forensic pathologists say in the jacket, they go in. In the tie knot, where nick the tie, the fibers are going out, and in the shirt, there's about 3/4 of an inch below the buttonhole was where the missile supposedly exited. So Commander Hume said, okay, I can put this together now. That was not an entrance wound, that's an exit wound. And so that became quite a discussion later on as to whether it was an entrance or an exit wound. But the determination was that it was an exit wound. This is a gross picture, but I think it's an autopsy picture. I've called your attention to the forehead, and there's been discussion as to whether this was altered from the time that what we saw in the emergency room. This may be a bone flap down over the forehead and not actually injury to it. This is what we saw, and I call your attention again to this area in the forehead. There was no damage there. He has a bushy head. We didn't see what you just saw. I think that was an autopsy, and they'd probably pull the scalp back. Now, I mentioned that his face seemed relaxed, and this is the reason. You can see all the multiple skull fractures that he endured from that gunshot wound to the back of the head. This is Commander Hume in the center. I thought he was an older physician, but he was 38. And this is Dr. Boswell. They're the ones that performed the autopsy. Here they are a number of years later. On the right is Boswell, and on the left is Hume. Hume and Boswell wrote notes. That night, Dr. Hume rewrote the notes that he had taken and put them on a different piece of paper. He said the original paper was bloodstained, and so he threw those notes away, actually burned them. And when asked, he said he didn't want somebody to try to take them and make profit off of those notes. He said they had not done anything to alter the body. They didn't do anything to alter the description of the autopsy. And Commander Hume died at age 74 of lung cancer. By Sunday morning, the Oklahoma newspaper said Oswald was the killer and that the case was cinched. And we know now that probably the case was not cinched. This is the casket in the White House as staff could come by and view it. It was well publicized again that on Sunday morning, after the Friday, that Oswald would be moved at about 11 o'clock. This was in the paper Saturday morning. And during the evening that night, some of the police said maybe we should move him during the night in case something should happen. And Jesse Curry, the chief of police, said, no, I promised the news media they could be there. I'm keeping my word, but we will move him in an unmarked police car. They had planned to move him in this armored truck that goes down into the basement of the city jail. And so they decided they would use that as a decoy. Jack Ruby was at the telegraph office about 350 feet away, 3 or 4 minutes before Oswald was brought into the basement. And somehow he got down there and entered a side door. And as soon as Oswald was brought out, he runs from the crowd and shoots him with a snub dose 38 caliber pistol. This is, to the left is Will Fritz, head of homicide. This is Jim Lavelle. He's 36 and he's handcuffed. He's a detective, handcuffed Oswald. Oswald turns and what I sort of term as a shish kebab area of injury because he had tremendous injuries behind the abdomen, which I'll go into in just a moment. So this is Lavelle at 36 there. And here he is about 3 or 4 years ago being honored by the police department. And he died in August 2019 at the age of 99. The suit is now in the school book, in the JFK Museum, and I understand it's valued for insurance purposes $75,000. This is Oswald as he was brought into Parkland Hospital on Sunday morning. I happened to be at the hospital and I was staffing a stab wound to the neck, and I've just finished and went into the little area where we had to sit, which was really a sort of a nursing station, and the telephone rang. The nurse answered it and turned to me and she said, they've shot Oswald and they're bringing him here. I had seen Dr. Perry and Dr. Jenkins in Dr. Jenkins' office just outside the operating room before I went in. I went over there and they were still there, I'm sure talking about the president. And I said, Oswald's been shot and they're bringing him here. We went down to the emergency room and we got there a minute or two before Oswald did. They brought him into trauma room 2, which is where Connolly had been. And I listened to his heart and he had a heartbeat, no blood pressure, unresponsive. Dr. Jenkins put an endotracheal tube in. I did a cut down, a venesection to get an IV in the left arm, just the same area that I had done on Kennedy. And I put a chest tube in on the left side the same way because he had been shot in the left lower chest. We had him to the operating room within 10 minutes. In the meantime, Dr. Tom Shires had turned around. He'd been in the car, had left Parkland, but came right back and came into the emergency room right before we took him to surgery. So he was the operating surgeon. This is a picture that showed up somehow many years later through Baylor in Waco. This is Dr. Jenkins, who was chief of anesthesia. This is Dr. McClellan with the glasses on and head turned over the right shoulder. I'm in the right upper corner here and holding a retractor. I can't identify Dr. Perry. Dr. Shires is on the other side of me. We worked on him for Dr. Shires and Perry primarily for about over an hour. And he was pronounced dead at 1:07 p.m. This is Dr. Shires speaking with the news media. And I'm somewhere back in this crowd, not in this picture, as is Dr. Perry. This is the operating report. And it shows that Dr. Shires is the surgeon, assisted by Dr. Perry and Dr. McClellan, and I'm the third assistant. It was estimated that he lost about 16 pints of blood. His injuries were such that he had a gunshot wound to the left lower chest. It went through the diaphragm and then went across what we call the retroperitoneal area behind the abdomen, blew the superior mesenteric artery off the aorta, which is the main artery out of the heart, and also supplies the intestine. And then the main vein coming back to the heart, the inferior vena cava, went through and through that, then went through the pancreas, the liver, the right kidney, and lodged under the skin in the right flank. And it was about the time that the bleeding was controlled that his blood pressure dropped from about 90. He never received any anesthesia, just oxygen, which makes me wonder, was he brain dead to start with? This is an autopsy picture. And this little cut here on the upper arms where I did the cut down to get an IV access. I can't tell where the chest tube was inserted. They'd cored out where he was shot right here. Parkland was a fortress. There were police on every floor, outside the building, inside the building. Parkland was built in a T-shape at that time. And if someone stood on the base side of it and looked at the right side, he was on 2 East. You could have gotten a shot off at Connolly. Connolly was on 2 East, and he occupied actually 3 rooms. There were doors between each room. They put lead shields over the windows so no one could perhaps shoot, and they moved him periodically from one room to another. Jack Ruby was arrested immediately and was tried in March of the following year and sentenced to death. He was 52 years old when this took place. And he died about a little over 3 years later before his appeal became possible. This is the Carousel Club that he owned. It's no longer there, but he had strippers in that. Ruby was born in Chicago and then came to Dallas. He never had a high school education. It possibly got as far as school and left school at the age of 16. By Monday morning, all the sporting events that evening, that weekend had been canceled, and most of the stores were closed. This is an item from Neiman Marcus just saying they would be closed all day on Monday. 1 week after the assassination, Lyndon Johnson appointed a commission to study the assassination of President Kennedy. And this is the commission. This is Gerald Ford, who was Republican House of Representatives from Michigan. The head of the Supreme Court was Earl Warren, and he was appointed head of the commission. And because of his name, it became known as the Warren Commission. This is Allen Dulles, I think head of the CIA at the time. And then there is Lee Rankin, who was the lead counsel for the commission. They met 1 week later in December after they had been appointed. The FBI conducted 25,000 interviews and produced about almost 25,000 pages of documents. The Secret Service did 1,500 interviews, 800 reports, another 5,000. So they had about 30,000 pages of information. They interviewed the Secretary of State, Director of the CIA, the Director of the FBI, and others. And ultimately came up with a 26-volume Warren report. This is a condensed version. In February, I got a subpoena along with others, Dr. Shires, Dr. Jenkins, and Steve Landergan, who was assistant administrator, and to appear in court. This came in January of 29th, and to appear in February the 10th for Jack Ruby's trial and possible testify. Well, here are a bunch of witnesses. Here I am, the crew cut on the left, and Kemp Clark is the chief of neurosurgery. Steve Landergan is the head of, is the assistant administrator from Parkland, and Tom Shires is the chief of surgery. We actually never had to testify, but a few days later, I received an airmail letter. You don't see that much anymore, but it was from the President's Commission of the Assassination of President Kennedy. And it was from Lee Rankin, chief counsel, and he said that Arlen Specter would be in Dallas on Friday, March the 20th, and sometime after that, he would interview me at Parkland Hospital and take my testimony for the Warren Commission. Arlen Specter subsequently, well, at the time had already been asked to defend Richard Nixon, and he had, in the Watergate scandal, he turned that down. And he was a junior counsel for the commission, and he's the one that came up with the single bullet theory, or the magic bullet theory. You may recall he was a senator eventually from the state of Pennsylvania, and ran for president. But his theory was that the president was shot from the back, and that it exited the neck in the front, and it tumbled, and the missile perhaps went sideways and hit Connally, and right below the nipple line in the right chest, about the 5th rib level. And then Connally had his arm across his thigh. So it went through his right wrist, and either the missile or a fragment went into the left leg. And Dr. Shires had been in Galveston, as I mentioned, and he arrived in time to operate on Connally on Friday as far as the leg was concerned. Robert Shaw, the head of thoracic, operated on the chest run along with Dr. Duke. Well, one of the things that was of interest to Arlen Specter was the fact that, number one, I thought this was an entrance wound and not an exit wound. And and the other thing was that a missile was found on the cart of Governor Connally, not on Kennedy's, but on Connally's. And so he asked me, he said, well, what would you think this wound would have looked like as an exit wound? And I said, well, I would have thought that with very little damage, it was just a 1/4 inch wound, no powder burn, that maybe the wound, that the missile had just gotten through the skin and fallen out. And I had not known that the missile was on the cart at that time. And so his theory was that it was that the same bullet hit Connally. Well, if you stop to think a minute, if the bullet's on Connally's stretcher, he's shot in the limo, he's taken out of the limo, put on a cart with his suit, taken to trauma room 2. Dr. Duke undresses him, puts a gown on him, takes care of his chest wound temporarily, puts sheets on him. He's taken up to the operating room, put on an OR table. The sheets are taken off and folded, put back on the stretcher. Stretcher comes down and is placed in front of a bathroom. Somebody uses the bathroom, moves the stretcher, and the missile falls off. So that's hard to believe that nobody saw that, but I guess it's possible. One of the questions, and I'll go on, is that Inspector asked me, he said, well, are you a ballistic expert? I said, no, but I've seen a lot of gunshot wounds. And he said, well, have you ever seen a rifle injury that struck somebody in the back, exited in the neck, didn't strike bone, only soft tissue, that was shot from between 160 and 260 feet with a muzzle velocity of 2,000 feet per second? And I said, well, no. And not being sarcastic, I mean, you just do not get that type of information from the average gunshot wound that comes into the ER. That next year, I looked to see what our experience was, and we saw 1,271 gunshot wounds that year, and we admitted 515. So we saw 1 to 3, 4, or 5 sometimes a day. This is the pristine bullet, where the nose is pristine, but the base of the bullet is not. And I've talked to the National Archives, and I can show this, this public knowledge, they said. And so there was damage to the base, and there were fragments missing from the base of this bullet. Here are some of the fragments. Some were found under the seats in the limo. Some were found when Dr. Gregory operated on Connolly's wrist. And this is probably a fragment that hit the windshield of the limo. It's not from the outside, it's from the inside. Okay, so what did we learn from all of this? Remember I mentioned that we needed a phone that we could call out on and nobody could call in on. And so these hotlines were established at Parkland, the red phone, not used now because there's better technology, but that was one of the things. Second thing was we wrote a trauma book. And not at the time, all the trauma books had been on orthopedic problems, fractures, and so forth. And this trauma book was not about the assassination. It was about gunshot wounds, stab wounds, automobile accidents. Although Governor Connolly's chest x-ray is in this book, talking about a sucking so-called chest wound. Dr. Shires applied for an NIH grant, and we got a 4-bed shock trauma unit, primarily to study fluid shifts in the patients with severe injuries. The Mayor Wes Wise had the Greater Dallas League of Municipalities developed, and they thought, the Greater Dallas League thought that we needed an ambulance service in Dallas. This was about 5 years after the assassination. And at that time, we didn't have an ambulance service. Everybody was transported either by a funeral home hearse or by a station wagon. No one was in the back. The patient was strapped down, and an ambulance driver only had to have 18 hours of Red Cross training. So they had no experience, often just a single driver. So I was made the medical director to establish the ambulance service in Dallas, Texas, along with the assistant chief of the fire department, Bill Roberts. And we worked for about 2.5 or 3 years. You can't imagine trying to work through with all the hospitals and the various staff to get this established and the city council to approve it. And the first time they rejected it, but Gene Denton, who was assistant city manager, worked closely with us, and we finally got it passed. And this was developed in conjunction with the U.S. Department of Transportation. There was a big discussions, where's the base station going to be? All the hospitals wanted it, but nobody wanted to man it 24 hours a day. So the fire department, the EMTs managed it, and we put it at Parkland. The hospital is sort of a neutral place. This is the first time anybody had ever ridden with a patient in the back of an ambulance. Well, in the center here is Dr. Tom Shires. The left is Dr. Perry. I'm here in the white coat with a crew cut as chief resident. Next to me is Dr. Robert McClellan, Dr. Charles Baxter, and up here in the center is Dr. Jim Carrico, who was the second-year resident, the first one to see the president. People came from all over to the funeral. This is de Gaulle in the front, Haile Selassie in his left. princes and princesses from all over. Miss Kennedy walked from the White House to St. Matthew's Catholic Church with Robert and Edward. That next spring, I went to the Chief Residence meeting at the Airlie House in Warrenton, Virginia. And that was where President Eisenhower had his retreats. And on the way back, I wanted to stop by the Arlington Cemetery and see the eternal flame. And here we are several months later, people still going by all day long, flowers still there, being brought every day. Nobody knew who I was, and I didn't know who they were. May he rest in peace. Thank you.
Thank you so much, Dr. Jones. Your amazing memory to recall all those details still impresses me. And I know that was a very dark day in Dallas and all over the world. So thank you for sharing the details with us. I have some questions now that were previously submitted. The first question is, as a witness and participant in two historic moments, and after years of reflection, are you glad you were at Parkland that day, or do you wish you had not been on rotation?
Well, I was glad that I was there. I think we wish that we could have done more than we did. We wanted to do something for the president, and the question's often been asked, should you have done anything? And we felt like we should have done something rather than do nothing. But we were glad to have participated in that endeavor.
The next question is, was it more difficult to work to save Oswald since he had possibly assassinated the president?
You know, this is often brought up. At the time, he had been charged, but he had not been found guilty. And as you know, there are a lot of times when people may be charged with something and then ultimately they're found innocent. So you have to treat the patient, and we treated a lot of gunshot wounds, many of whom had been criminals, and you just don't take that in consideration. You try to save them and let the courts decide who's guilty and what their future is.
Thank you. What medical advances have we made since that day, and could we have saved the president with any of those advances?
Well, there have been a lot of advances, as you know, made from general surgery, laparoscopic surgery, robotic surgery, lots of better monitoring equipment, anesthesia equipment. But if you looked at that head injury and you saw the Zapruder film, which we had not seen at the time, we didn't know how he had been shot, with what he had been shot, how many times he'd been shot. But if you look at that head injury, there's no way that he could have been saved. Now, had he only had the gunshot wound from the back to the neck, that was a salvageable injury, but not the head wound. It had literally exploded. And if you get a close-up view of the Zapruder film, you can actually see brain spew out the front.
And here's one of the key questions I know participants would love to hear your opinion on. Did the trauma to the president's body reflect a shot from the front or the rear, in your opinion?
Well, as I mentioned in the presentation, and when we first saw the injury to the neck, I think all of us thought it was an entrance wound. And so I can't change what I initially thought. Now, with the evidence at autopsy and the forensic pathologist saying that the fibers from the back go in and the neck fibers go out, their conclusion was that was an exit wound. And so I have no qualms with finding the autopsy. However, I would say that if it ever came about that someone else was involved with the shooting, I would think that could be an entrance wound, no question about it, but it could also be an exit wound.
So how did this experience change you as a person and a physician going forward?
I don't think it changed me as a physician. I think initially we didn't talk about this hardly at all. And in fact, I think one of the Reader's Digest, matter of fact, offered to pay us to write an article, and Dr. Shires felt like that was inappropriate. So we didn't write anything for a long time. I never made a presentation on it for 25 years probably after it happened. I don't think it influenced me a great deal. I think it called our attention to the fact of thoroughly examining a patient. We felt like it was improper for us to turn the president over after we knew he had expired and Mrs. Kennedy was in the room and so forth. But examining the patient fully is something that we would have learned from that. Usually we would have done it. But I don't think it changed me very much. I think we didn't like to talk about it. It was unpleasant to talk about. And so maybe that was a result of having treated him, but nothing else, I would say.
So what advice would you give a young physician who is called on to treat a famous person for a traumatic injury? And I'm sure there was a young doctor in a trauma unit who had to treat Tiger Woods recently. What advice would you have given that young physician?
I think you do what you're trained to do. And it's just like we had done so many times. You just get into gear and you immediately start treating that patient as any trauma patient. I mean, they had the same thing to deal with when President Reagan was shot. And you know to get the airway, you know to get the IV access, you know to do some brief neurologic exam. And once those things are done, then you can assess what the injuries are. But you get into that mode if you're in a major trauma hospital, and you forget temporarily about the. I mean, you know that it's a famous person, but you react like you would react like you were trained to do.
Thank you. Is there anything that you wish you'd done differently on that day?
I don't think there's anything we could have done that would have saved the president. As I said, we felt like we should try something rather than do nothing. I think even if I'd listened to the heart and he didn't have a heartbeat, maybe he had just died. And sometimes rarely you can bring somebody back. We had not seen the Zapruder film. We had not examined his head that thoroughly when we tried to get the IV going and the airway going. So I don't think there's anything differently that we would have done unless we just didn't do anything.
Thank you. Was the medical staff at Parkland pressured to place certain findings or conclusions in any of their reports?
No, I wasn't pressured in any way. I did mention one time that when Arlen Specter finished with me, he asked me to come outside in the hallway. And so I went out and he said, because I had talked about the entrance wound, and he said, Dr. Jones, I just want you to know that we have people who will testify that they saw someone shoot him from the front, but we don't think the testimony is valid, and I don't want you to say anything about it. And I didn't say anything about it for years because we were afraid to do anything that would raise any suspicion. But I wouldn't say that was a threat, but I thought it was interesting that he said that, but nothing's ever come forth that would change the Warren Commission report.
Tell us a little bit about your agreement or disagreement with the Warren Commission findings.
Well, I don't really, I can accept the Warren Commission findings. We just had a difference of opinion early on as to whether that was an entrance wound or an exit wound. But based on the Dr. Hume's autopsy and the forensic pathologist, it seems that he was shot from the back. There's never been anything brought forward that would indicate otherwise. Nobody's come forward and said they did it, or nobody's had an investigation that proved that something else, that someone else was involved. So I don't think there was a disagreement necessarily with the autopsy. We weren't there for the autopsy. As you may know, Earl Rose was the medical examiner at Parkland Hospital. And the law was when you were shot in Dallas County, you were autopsied in Dallas County. So we weren't at the autopsy, and obviously Dr. Hume was not with us. So I think had the autopsy been done in Dallas County, there could have been a little better communication than there was with it being done in Maryland and then him being shot in Dallas. So that could have improved things, but I don't know that it would necessarily have changed anything. Parkland was not known as a trauma hospital at the time. Walter Cronkite at one time, you may have seen on television right before the president was found to be dead. He said the president's been taken to Parkland Hospital, and we think they have equipment and staff to manage a trauma patient. So it was after that that Parkland sort of became known as a trauma hospital more than it had been in the past.
Of all the movies and documentaries about the assassination of the president, is there any one of those that you feel is more correct or more historically accurate?
Well, the one that I can't remember whether it's named Parkland or not, but it's the one that shows Mrs. Kennedy being hysterical in the ER and blood squirting everywhere, and that was not the case. It was very crowded, but we were able to function normally. When somebody has died, they're not pumping blood. The heart's not pumping any blood, so you're not seeing blood all over the place. Mrs. Kennedy was very calm. She was not hysterical, as was shown in that movie about Parkland. There have been many books written. It's interesting to go to a bookstore and then see your name. It's often the same quote. Sometimes it's taken out of text. They said something, and then they attempt, many of those books have attempted to show a conspiracy theory. And that seems to be what's being what they're trying to do in many instances. But I don't know that I've seen any movies that were particularly accurate. There was one documentary out of London, I think, and some of the physicians in there were not even present weren't even at Parkland at the time. So you have to take some of that stuff as a grain of salt.
Thank you. Could you describe Mr. Oswald's injury in greater detail and why it was fatal?
Okay, he's shot in the left. He if you notice in that film, in that picture, he turns this way, and in doing so, the part of the abdomen where the stomach and the intestine and the colon is called the abdomen. Behind the abdomen, we call the retroperitoneal area. And in areas where major vessels and other organs are. And in this case, the gunshot wound went through the left chest, and we did open his chest at the time of when he arrested at the table. The chest tube was in place, and the bullet went through the diaphragm, but it went retroperitoneal, and it blew the superior mesenteric artery, which is the major artery to the small bowel and the colon, blew it off the aorta. The aorta is the main artery coming right out of the heart and pumps blood to all of your extremities. It's estimated that somebody shot in the aorta can possibly die within seconds. Then the injury went from the aorta. On the right side would be the vena cava, right next to the aorta. The inferior vena cava, that's the main vein that brings blood from the legs and the abdomen back up to the heart. And so he got that through and through. Then lesser injuries, which possibly would not have caused him to die, would be the that it went through the pancreas, the liver, and the right kidney. Those injuries could have been managed, but the injury that killed him was the injury to the abdominal aorta and the inferior vena cava. That's the major artery out of the heart, and the major vein into the heart. And he just bled to death.
Thank you. Here's a really interesting question. Did you ever meet or hear from members of the Kennedy family after that day? And if so, what were the circumstances and what was said?
Well, we never heard from any of the Kennedy family that day or for years after that. There were 935,000 notes that were sent out from Mrs. Kennedy, and I was told that Parkland Hospital received one of those notes. But so far as I know, none of the staff were contacted by the family, and I'm sure it was unpleasant for them to know that he was killed in Dallas. And so that, I'm not sure how they felt about that. Subsequently, there has been one of the Kennedy nieces in Dallas, and I met her, and she's very nice, very complimentary about the care that her, I guess it was her uncle, received. And I think that might have been Robert Kennedy's daughter. I'm not 100% sure. It seems like it was.
Yes, it was. It was Kathleen Kennedy Townsend, who came
Right.
a couple of years ago to speak at a reception that we had at Parkland about the JFK Park. And I should let everyone on the call know we did get permission from the Kennedy family to design and build the park in honor of the president. A few more questions, Dr. Jones. What was your biggest lesson learned from this experience? And maybe was there a way that you coped with this tragedy as a young physician? It was a lot.
Well, I don't know that I learned anything from this particular case. It was just a severe head injury that we couldn't do anything about, and couldn't do anything about it with anybody. Occasionally, I had seen patients who were shot with a smaller caliber gun, and they had eventually, over a period of months, recovered from it, but not anything this massive. So don't know that other than the fact that would have paid a little more attention to the injury in the back. Had we seen it, we would have known. We still might not have known whether that was an entrance wound or an exit wound, just seeing the injury to the back. But you just need to examine the patient and go through the ABCs of managing the trauma patient.
Thank you. I think we've got a lot of people wishing that you were their personal physician at this point. One last question. I think it's such a good one. Did this event give you and your colleagues at the time a sense that you would be forever bonded by this profound experience?
I think so. Maybe not immediately, but as people began to call and the news began to call, it didn't take long to realize that you were going to be associated with this. I did think initially that it would subside and not carry on as long as it had, but it really became more. There became more notoriety at the 40th anniversary, and then particularly at the 50th anniversary. It was unbelievable. People were calling and visiting from all over the world. They were wanting interviews and from people here from Russia and all over the United States. Major television and news networks asked you to be on the program. And for a couple of weeks there, was almost a full-time job just to keep up with it. But anyway, that it obviously did connect us for the rest of our lives. One of the things that's sort of interesting, if you go to a dinner and nobody knows we're at Parkland until they begin to talk to you and what do you do and where'd you train or something, and well, I was at Parkland. Oh, well, were you there when Kennedy was shot? Yes. Well, from then on, there's either 5 or 7 of those people, or just one of you, and going around the table asking many questions, just like you have asked me, you can't have a chance to eat. And you eventually say, why don't we hold the questions till we finish eating, and then I'll try to answer all the questions.
And you're always so gracious about that. I should say that we are really grateful for your time today. And I should let everyone on the call know that I've been so lucky to not only work with Dr. Jones, but some of the other, Dr. McClellan, before he passed away, also worked with us at Parkland. And I should also let everyone know that we are, despite many years of healing, we are still heartbroken in Dallas over what happened, heartbroken in the country. And really all of the physicians that worked to save President Kennedy wish it could have turned out very differently and are a little bit heartbroken about that. And we will never forget that. That's why we want to remember them and everyone else in our John F. Kennedy Park for Hope, Healing, and Heroes. Thank you, everyone, for participating in today's event. And thank you to you, Dr. Jones, for giving us such an inside look into what happened on November 22nd, 1963. We look forward to seeing all of you again for future programs, and we encourage you to stay tuned for upcoming events sponsored by the Washington University Alumni Association.
Well, thank you, Cindy. I appreciate Cindy Scott and her help, and Jenna Clark and Chris Kennedy, and your husband, Alan Treese, for helping with the production of this program, so to speak. Thank you, Cindy.
It was our pleasure.